This really isn't just a state level issue. This is really affecting us as a country.
A call for help in the middle of the night from hundreds of miles away. Thank you for joining us at 11. I'm Amanda Starantino.
And I'm Mark Mullins. New tonight, a surgeon is sharing her experience to show how skyrocketing COVID cases and overworked healthcare systems in other parts of the country can have an impact on central Indiana.
WRTV's Cornelius Hocker shares her message with us tonight.
For weeks, national reports have shown many states with low vaccination rates are struggling with a huge increase of COVID-19 cases, leading to an increase in hospitalizations. Arkansas is one of those states. The situation's so dire, a hospital there is turning to central Indiana for help.
Interestingly, last night I received a phone call requesting a transfer for a patient from out of state into one of our IU Health hospitals.
Dr. Jennifer Hartwell, a trauma surgeon at IU Methodist, shared a little bit about this phone call on Twitter. The question many people had for her: why transfer a patient more than 600 miles away?
I queried about the reason why, and it was because there were every hospital that hospital had called didn't have space available. They were on diversion status. The patient that they were requesting to transfer was not necessarily due to COVID. It was for non-COVID related reasons, but I think it really highlights that this has become a national issue.
Dr. Hartwell says COVID-19 patients require more than just a bed. Many require constant care and monitoring, which ties up resources. She says all those factors, plus the chance of staffing shortages, likely led to the phone call she received. Despite the increase of COVID cases here, Dr. Hartwell says Indiana hospitals are faring well.
Currently in the state of Indiana, we are not overwhelmed with COVID patients, and I hope that we are not. We maintain capacity to take care of COVID patients.
Dr. Hartwell hopes sharing her story will help people make the best decision to protect themselves and their community, to prevent what's happening to healthcare systems in other states from happening here, which would impact healthcare workers who've done so much since the pandemic started.
It is fatiguing to be in healthcare right now, mentally and physically. And I guess, I guess I can't convince anyone of that truth. I just can only tell my own story.
Cornelius Hocker, WRTV.
Well, as of Thursday, the State Department of Health says about 1,000 patients are in Indiana hospitals with COVID-19. That's about a third of the hospitalization peak that we reached in early December. About 30% of the state's ICU beds and 77% of ventilators are available right now. These graphs show how availability of those resources have changed through the pandemic. The green here indicates the amount of ICU beds and ventilators available. You could even see that during the peak of hospitalizations, Indiana hospitals had both available for patients.